one of the best treatments for concussion is exercise therapy. We start with this one at Complete Concussion Management. This is kind of our go-to starting point right off the hop. If somebody comes in with persistent symptoms, the first thing we're going to do is we're going to put them on a treadmill. Now, you want to do exercise for treatment, but you have to do it in the proper way. You can't just tell somebody to go and exercise, because they need to know at what intensity, what type of exercise, what the duration of that exercise should be, and all of these certain things. Now, that's going to depend on the results of your treadmill test, because the exercise that's actually therapeutic is sub-symptom threshold exercise. So the first thing you have to do is establish what their symptom threshold is, and then use that to guide the rehab moving forward. Now, the evidence that's come out on the Buffalo Concussion Treadmill Test has shown that it is very effective as a treatment modality for persistent concussion symptoms, and it's always our go-to, because the Buffalo Concussion Treadmill Test also tells you kind of the concussion trajectory that people are on. So what's causing their symptoms? Well, you have kind of 5 main causes of symptoms, and this ties right in with the treatment that we're going to talk about. So the number one cause of persistent symptoms, and these aren't in any order by any means, but just the one that we talk about first is a blood flow abnormality. So blood flow abnormality, or autonomic nervous system disruption, some sort of physiologic mechanism within the brain that's leading to persistent symptoms, kind of on a global front. And that's where the test for that is exercise, and the treatment for that, if it's positive, is also exercise, but done in a specific way.